of the U.S. is seeing an increase in coronavirus infections, and infectious disease experts are warning that this pandemic is far from over. So what's causing these spikes in cases? Former Acting CDC Director and CEO of the Robert Wood Johnson Foundation, Dr. Richard Besser, joining me now. Dr. Besser, how concerned are you about the rise in cases that we're seeing here?
Well, Allison, I think you need to look at each state independently to see what's going on. Mm-hmm. As states start to open up and there's more activity, both economic and social, there will be increases in cases. And what you want to see is there room in your hospital? Are you anywhere near or to overwhelming your healthcare system? Are you able to collect data to see which parts of your communities are being impacted? As you and I have talked about before, in this pandemic to date, Black Americans, Latino Americans, Native Americans, low-income Americans have been hit incredibly hard. And if public health isn't collecting data to be able to see what's going on in every neighborhood, these same groups are going to continue to get hit hard as people go back to work more and more.
I know there are a couple of other issues that people are wondering about. For example, when might we have a better understanding of what potential impact the protests had on spikes in cases? Are there certain timeframes or timelines when you say, okay, we'll have a better understanding, we could look back and say this caused it, this reopening was part of it, and we need to make some changes?
Yeah, I mean, this is bread and butter, boots on the ground public health work. So in each locale, as cases are going up, you have to do that hard work to see what's going on here. Is it something related to Memorial Day activity? Is it something related to protesting? Are protesters being instructed in terms of social distancing and wearing masks? Is there appropriate testing in communities where protests are taking place? Or is it other things? Do workers have what they need to protect themselves when they're going back to work? In each place, it could be something different. It could be something that needs to be addressed in terms of personal protective equipment. Clearly, one of the things that we need to see more of is public health leaders out there talking about why it's so important to continue to wear masks and social distance and hand wash, because without those measures, any of these steps forward towards opening the economy are going to lead to retrenching when we have to put them back in place because we're not doing the right thing to keep the disease activity as low as possible.
We've seen states like Oregon, Utah, Tennessee pausing some of their reopening plans because of concerns about spikes in coronavirus cases. Should more states be doing that?
Well, yeah, I mean, it's just like that in that report you showed from Italy, where there was a building that they put under lockdown because there were more cases. That's the kind of thing that we should all expect to see, that, public health gives us the roadmap forward. And if we follow that carefully, we'll be able to open, we can detect quickly any little outbreak that's taking place, put that under lockdown by ensuring that we have contact tracing going on that meets the needs of everyone in each community, that people have safe places to isolate and quarantine. To date, it's been a real challenge. Imagine if you're told that you are positive for coronavirus and that you should go home and keep away from others, and you live in a household with your grandparents or with somebody who has heart disease. We need to make sure that everybody who is positive, who's been in contact, has a safe place to isolate and the economic support, the nutritional support to do that, so that little outbreaks or new cases don't lead to a major outbreak in a community.
Dr. Besser, the New York Times is reporting that slowing the spread of coronavirus is actually speeding up the spread of other diseases. Can you explain that and what's going on here?
Yeah, I mean, this is a big issue in terms of global health. It's another reason why we have to remain engaged with the global health community. We provide a lot of resources and expertise. But what's happening in many parts of the world, and we see this in the United States as well, is because of COVID, a lot of other public health and health activities have shut down. And so around the globe, there are children who aren't getting vaccinated for measles. The efforts to wipe polio go off the face of the world are on hold because of COVID. And so you're seeing outbreaks of measles, you're seeing outbreaks of cholera, you're seeing vaccine preventable diseases occurring. And it's a big concern in the United States. And it's why I'm a pediatrician. It's why we're telling parents, contact your child's doctor, make sure that your children are getting their vaccinations so that we don't see outbreaks of these diseases in the United States because of fear from COVID.
Dr. Besser, one last question for you. Today, the FDA withdrew its temporary authorization for the emergency use of hydroxychloroquine. What does that mean in terms of our search for COVID-19 treatments?
Well, it means a couple things. It means that I'm thankful we have a Food and Drug Administration whose job it is to make sure that the drugs that we use are safe and effective. And so while there was initial thought that these drugs may have benefit, the studies haven't shown that, and so they've withdrawn that approval. We have remdesivir that's available that can shorten the course slightly, and hopefully there'll be new drugs coming. But when those drugs come, we all have to wait and be sure that those drugs are not just safe, but also effective for these conditions. Otherwise, there's so much misinformation out there on the internet. If we're not hearing from public health leaders about this, people can really do harm by thinking something will give them benefit when it truly has no benefit at all.
Yeah, it's really important to know where that health information is coming from. Dr. Besser, it is always a pleasure to have you on. Thank you for coming back.
Thank you, Allison. It's great to be here.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.